People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms are mild for most people and begin gradually. Common symptoms include fever or chills, cough, shortness of breath, or difficulty breathing. Other combinations of symptoms have also been reported, including fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Symptoms may appear 2 to 14 days after exposure to the virus, with a median of 4 to 5 days. If you or your child are experiencing any of these symptoms, call your primary care provider for guidance. Based on what is currently known, spread is thought to occur mostly from person to person by respiratory droplets among close contacts. A close contact is defined as being within approximately 6 feet of a COVID-19 case for at least 10 minutes or direct contact with infectious secretions from a patient with COVID-19. Infectious secretions may include sputum, blood, and respiratory droplets, such as being coughed or sneezed on.
Germs can be spread to others through droplets of saliva that we make when we cough, sneeze, talk, and sing. These droplets can then be inhaled through the nose or mouth.
Given the growing evidence of transmission risk from asymptomatic or pre-symptomatic persons, the person of exposure risk starts at 48 hours before symptom onset. The risk of transmission is thought to be greatest when patients are symptomatic. Transmission to persons from surfaces contaminated with the virus has not been proven, but current evidence suggests that COVID-19 may remain viable for hours to days on surfaces made from a variety of materials. This fall, we will not only be concerned with COVID-19, but also influenza. Influenza, also known as the flu, and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. Unlike COVID-19, there is a vaccine to help protect against flu viruses. Now is a good time to schedule your appointments for you and your children's flu vaccinations. There are simple things we can all do to protect ourselves. The best way to stop the spread of all germs is to clean your hands often. 2 methods of hand hygiene include alcohol-based hand sanitizer or soap and water. When performing hand hygiene, technique counts. The areas most often missed by individuals are the thumbs, fingertips, and between fingers. In order to use hand sanitizer correctly, your hands must be visibly clean. Apply the product to the palm of one hand. Rub your hands together, making sure to rub the product over all surfaces of your hands and fingers until your hands are dry. This process should take approximately 15 to 20 seconds. Soap and water are used when hands are visibly dirty. After using the bathroom, first, wet your hands with running water. Apply soap and lather well. Rub your hands vigorously for at least 20 seconds. Be sure to scrub all surfaces, including the backs of your hands, between your fingers and under your nails. Rinse your hands well under running water. Dry your hands with a clean paper towel, and then use the paper towel to turn off the faucet. Avoid close contact with people who are sick and practice social distancing when outside your home. Stay at least 6 feet, which is about 2 arms lengths away from another person. There are also additional steps that you should be taking to stop the spread of all germs. Cover your coughs and sneezes. Always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Immediately wash your hands with soap and water for at least 20 seconds. And if soap and water are not readily available, clean your hands with hand sanitizer that contains at least 60% alcohol. You should also make sure that you are cleaning and disinfecting surfaces frequently. All frequently touched surfaces should be cleaned at least daily. These surfaces include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. You should be sure to monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or any other symptoms of COVID-19, and stay home when you are sick. Also, remember to wear a mask. When you wear a mask, it protects me. When I wear a mask, it protects you. My colleague, Chris Hunt, will demonstrate the importance of wearing a mask.
Okay, so I'm going to talk to you today about how to properly wear a mask, whether it's a homemade mask or a mask that you buy in a store. The important things is once you put the mask on, you want to make sure that you get a good fit. And so what you need to do first is you're going to put it on. Where the straps go over your head or over your ears, you're going to make sure that they're on. And then you want to have it snug to where it goes under your chin and over the top of your nose, and it's snug against the face as best it can be. When you have the mask on, the most area considered to be the most contaminated is the front of the mask, so you never want to touch it. Really hard to do is not to touch the front of the mask. It's easy to find yourself touching it, and so if you do that, you need to be aware and then just wash your hands with soap and water with hand sanitizer if you do touch it. If you do need to make adjustments to the mask, two things. First, wash your hands again because you're going to be touching your face, and so you want to make sure your hands are clean. And then if you have to make an adjustment, you can pull it back down underneath and then wash your hands again and you're good to go. If you can make adjustments from the sides, from the ear straps, it's always safer to do that, and do that from the straps themselves to make an adjustment on the mask. But again, always wash your hands before and after any time you touch it. When you're out in public, one of the things that we see people doing often is they'll take the mask and they'll lower it so that part of the mask is like this, and they bring their nose out. The problem with that is that when you have this part of the mask underneath your nose, it's easier for you to inhale and breathe in all the things that were trapped on the front of the mask, and so you want to make sure not to do that. So if you're going to take the mask off for any reason, to readjust or whatever, or to talk to somebody that needs to read lips is one of the issues that we're seeing, why people take their mask and move it and adjust it. You don't want to put it under your chin, you don't want to put it under your nose. You want to take it completely off if you need to do that, and then go ahead and put it back on. Again, once you've got it put back on, you want to make sure your hands are always clean every time you do that. Another thing that we see people doing is they'll take the mask and they'll have it hanging off their ear and they'll walk around like this, or they'll have it where it's completely under the chin. Again, these are things where you can inhale those things, or the mask can actually come off and wind up on the ground. So again, if you do take it off, don't leave it hanging on your face, don't leave it on top of your head. You want to take it completely off. And then again, when you go to put it back on, make sure that you're washing your hands. And you always want to make sure that you have one side that you know is the side that goes to the face, and one side that always goes to the outside. So the homemade masks are good because you can wash them. So it just goes in a regular wash like you'd wash anything else, and then you'd be able to reuse it again after. A regular mask that you buy somewhere, those don't have that same capability, so you use them until they're either soiled, too dirty to be used, or falling apart. Obviously, you need to replace it. Other things that I wanted to point out about just wearing the mask and out in public is you don't want to share your mask with another family member. So if you wore it today and then someone else needs a mask later on in the afternoon and you haven't washed it, you shouldn't give them your mask to use. They should have their own. If they do need to wear the same mask again, it needs to be cleaned between uses, and everybody should kind of have their own. So that's kind of the basics about the mask and wearing them out in public. Our goal here is to make sure that you keep yourself safe, you stay healthy, and you take care of yourselves. Thank you.
Together, we can contain the spread of COVID-19. Please visit hunterdonhealthcare.org for more information on COVID-19, testing, and resources.